when you see some of these men, they first start out, they'll do everything like they're supposed to. They'll have great DHEA levels, great testosterone, you name it. And then, you'll follow up with them a year or two, maybe 3 later, and then they'll come in and they'll have all these complaints they didn't have, especially sexual dysfunction and issues like that. You'll find that those men will maintain their testosterone. They're all in on that. They just are not going to stop that. You can pry it from their cold dead fingers, but they'll stop everything else and wonder now why they're having problems that they weren't having when they were doing everything else. They just can't figure it out until it's pointed out to them. Well, wait a minute, your DHEA was 550 and you were doing great. Now it's 85 and you're not doing so great, but everything else is okay. Why would you do that? And this is what happens when you do. So look, it's about maintaining optimal levels of each, and because it is what aging is all about. Aging is insulin resistance. Insulin resistance is aging. That's what leads to all the complications that Dave just mentioned. 80% of age-related diseases are preventable, but they can all be traced back to insulin resistance. What happens to everyone as we age? Every single human being develops insulin resistance. They decrease lean muscle mass, they decrease body fat, especially visceral body fat. They become in a pro-inflammatory state. So it's about insulin resistance.